The Imagine Greater Buffalo series has two primary themes. Our first is to imagine Greater Buffalo as a premier international cultural and nature center. And our second theme, we added a few years back, is to imagine Greater Buffalo as a healthy, wealthy, and sustainable community. It is this second theme we will consider today, as we did last week when J.D. Hartman interviewed Neera Jory, who is the Director of Global Diversity and Sustainability at Rich Products Corp. Now, our featured speaker today is Scott Scanlon. Scott, a Cheektowaga native, has worked in journalism in South Florida, Central New York, and Western New York for 36 years, including the last 9 as editor of Western New York Refresh, a Saturday section in the Buffalo News focused on health, fitness, nutrition, and family life in the Buffalo Niagara region. So now, I am pleased to welcome Scott Scanlon to discuss, well, how we interpret and look closely at the annual Robert Wood Johnson Foundation New York State County Rankings. Scott, take it away.
Thanks, Dennis, and thanks, Leah, with the library system for inviting me for this talk. I'm noticing some names on the list of attendees, so there'll be other folks who can answer questions probably better than I as we get rolling. But let's talk about these county health rankings. So Western New York is blessed with a growing Buffalo Niagara Medical Campus, which during the last decade has added a medical school, more researchers, and an internationally known stroke center. Still, residents in the region collectively remain the least healthy in all of New York State. It isn't hard for those in medicine here to see why. Gates Vascular Institute is a wonderful institution. Dr. David Holmes, Chief of Family Medicine at ECMC, told me for a related story that we published on May 14th in Refresh. I want to go there if I have a stroke, but most of the patients who go there have preventable diseases from either diet, smoking, or lack of exercise. This is a point that was underlined again with the recent release of County Health Rankings and Roadmaps 2022. It's an annual report by the University of Wisconsin Population Health Institute that measures health factors and outcomes in every U.S. county. Half of the 8 counties in the region ranked in the bottom 10 statewide, and all but one, Wyoming County, are in the lower half. It has been this way for at least a decade. The first pandemic year spawned the largest single-year drop in U.S. life expectancy, 1.8 years since World War II, down from 78.8 years in 2019. County rankings researchers wrote in the latest report, as well as the largest spike in the death rate on record, up 17% from 2019 to 2020 to 835 deaths per 100,000 people. Provisional data suggests that numbers from 2021 could be even worse. So to be sure, the region has its strengths. The nuts and bolts in the latest report, which was released in April, show that each of the counties has higher high school completion rates and greater access to affordable housing than the state average. The gap between the rich and poor is smaller, and the number of social connections per person is greater in Western New York than in many other parts of the state. A slightly higher percentage of residents in Western New York also have health insurance compared to the New York State average. But the report—
I'm sorry to interrupt. Do you want to be sharing your PowerPoint?
Yes. Is it being shared? Well,
it is not being shared.
Okay, not at this point, but pretty quickly here.
Okay, just wanted to make sure.
Okay, the report, however, continues to list a lot of shortcomings when compared to state averages. Smoking and obesity rates are higher. Life expectancy is lower. In some counties, almost a decade less for those who are Black and Native American than the state average of 80.3 years. The number of poor physical and mental health days per month is higher, as is the percentage of preventable hospital admissions for those on Medicare, except in Erie County. which is a change from past years. So we are making progress in Erie County. Physical inactivity rates are higher than most of the county most of the counties in Western New York. Access to exercise activities is lower than all but Erie County for the first time in this report that I can remember, with the disparity most pronounced in rural counties in Western New York. Pollution rates are worse in all but Allegheny and Chautauqua counties, and most pronounced in Erie and Niagara County. So the report was funded by the Robert Wood Johnson Foundation and examines data mostly from 2020, the first year of the COVID-19 pandemic. Now I will look to share those slides. Okay. All right, so let's go through some of these slides here. Western New York and county health rankings.
We can't see your slides.
We can't. Okay. No. It's on my screen and I have just shared it, I thought.
No, you need to click share screen.
Okay, how's that?
Yep, there we go.
All right, good. Sorry about the glitch. Okay, so where we do well and where we can improve. So the health state of New York, Buffalo, Niagara is the unhealthiest region according to the report. What's measured here, the rankings consider an awful lot of things: low birth weight, child and infant mortality, mental distress. We have more of that than other parts of the region statewide, higher than the statewide average. Diabetes, HIV infection rates, that considers the health factors and outcomes. This year, the report also placed a greater emphasis on economic security, gender and racial disparities in pay, and the cost of childcare. You'll also notice that behaviors individually are also measured. Some of them figure into the rankings and some of them don't, but in the end, they're all related. And income inequality and children in poverty, educational status are weighed, and broadband rates, which are generally fairly healthy, except in a couple of regional counties, are also measured along with the high school graduation rates, which are higher than the state average, pretty much region-wide. So by the numbers, and here are some of the bottom lines, all 8 Western New York counties fall below the average statewide length of life, longevity, 80.3. And this fell by a year, mostly because of the pandemic. Wyoming and Erie counties have the highest longevity rates, while Cattaraugus and Niagara County have the lowest. The average life expectancy in Erie County is 2.3 years less than statewide. For Blacks in Erie County, life expectancy is 72.4 years old, almost 8 years less than the overall state average, and almost 6 years less than for whites in the county. Erie County ranks 46th overall out of 62 counties, primarily because of the quality of life here in terms of how we eat, exercise, work, play, and behave, as well as how we are separated by race and economics. Buffalo remains one of the poorest cities in the nation. The metro area fell out of the top 20 or top 10 most segregated larger regions in the nation after the 2020 census data was analyzed. Still, it stands at number 17 and continues to be considered highly segregated as far as those that data is involved. We're talking about, I think, a good 200 or so large metro areas that UC Berkeley measures. Here are some, here's a look at some Erie County health behaviors. You'll see where we stand versus the statewide average. Higher in adult smoking, higher in obesity. The food environment index is lower than what it should be ranked compared to the state average, 8.1 out of 10 versus 9. Physical inactivity, we're a little bit better. And one of the reasons maybe why in Erie County is that access to exercise opportunities is 93%. So in other words, we have a lot of options in Erie County when it comes to ways we can exercise. The challenge is that there's still quite a bit of physical inactivity and less activity than we should have. That is a greater problem and challenge in the rural counties. Their numbers are nowhere near 93%. Many of them fall in the 50 and 60 percentages. Excessive drinking is higher in Erie County, so is alcohol impaired driving deaths. Sexually transmitted disease infections here are lower than in other parts of the state, than the state average, but they're also fairly high. So the report concludes that many of the poor choices that go into health outcomes flow from the social determinants of health, including differences in education, employment and income, transportation, crime rates, and the cost of childcare in terms of overall family expenses that often drive challenges for well-being in poorer and rural communities. The pandemic both revealed and worsened the burdens and barriers of women, people of color, and people of low income face, said Sherry Johnson, the co-director of the county health rankings and director of the Population Health Institute at the University of Wisconsin. It also underscores that resources have not been distributed fairly within and across communities. Instead of framing health outcome questions around matters of personal choice, it's more reasonable to note that there are marginalized and vulnerable people in our community that are faced with few positive choices. Dr. Gail Burstein, the Erie County Health Commissioner, told me for the Refresh story. The report talks about equal pay this way. Women earn little more than 80 cents for every dollar men earn on average for the same work across the United States. To earn the $61,807 average salary of a white man, an Asian woman must work an extra month. A white woman, 3 more months. A black woman, 7 more months. An American Indian, Alaska Native woman, 8 more months. And a Hispanic woman, nearly 10 more months than a white man. Childcare costs exceed what's affordable, and they're a big problem in Western New York. Across counties, a family with 2 children spends on average a quarter of its household income on childcare. For those making the hourly $7.25 federal minimum wage, childcare costs would take up nearly all or 90% of their annual income. During the pandemic, the lack of affordable childcare forced parents, especially mothers, out of the workforce, and also hit childcare providers, who are disproportionately women, the hardest. The cost harmed families and communities' well-being. Now, it's worth noting, as I just said, that the percentages of income are higher for childcare costs than the state average here across Western New York. So let's take a closer look at some of the health disparities here, and in some cases by race. Low birth weight babies born in Erie County. You'll notice the total is 9, but it's higher for Blacks and Hispanics. And in 2020, it was 1 percentage point higher than it was in 2019. You see the life expectancy there, which we've already talked about. All of those numbers are lower for 2020 than they were for 2019, and the highest difference was for Blacks, 1.6 years lower. Child and infant mortality rates, the number of deaths under 18 per 100,000 per population. You can see the total for Erie County. For Blacks, it's almost twice as many. And there was a large jump for Hispanics in this category in 2020. The others remain unchanged from 2019. Infant mortality rates, that's under 1 year old per 1,000 live births. Blacks have an infant mortality rate in Erie County that's twice as high as the total, and 3 times higher than for whites. Teen births for ages 15 through 18 are considerably higher for Blacks and Hispanics in Erie County. Preventable hospital stays, you'll see the average, and again, you're seeing higher numbers for people of color here in Western New York. And one of the things I want to point out in this number is a lot of these are due to economic and institutional reasons. And then child poverty here in Erie County. 18%, which was down 1 percentage point for Blacks. It's 40% in Erie County, and that was down 5 percentage points in 2020. And then you'll see the numbers, for elsewhere. So the environment, access to medical care, social circumstances, and genetic figure into population health, Dr. Burstein told me. And public health departments seek to approach solutions from all fronts. What about you? You can take care of yourself with help from loved ones, your health care providers, and reliable sources of information like Western New York Refresh. But we all know that can be hard to do these days, especially after a pandemic, a mass shooting, and what that does to our overall health and well-being. The latest report, though, also includes a roadmap to better health and wellness, singling out communities and efforts that buck trends in a nation that spends the most on healthcare, yet yields the worst outcomes when measured against other leading industrialized nations. I'll have a couple of web addresses at the end of the slides that have the information on where you can take a look at the reports. And as I just said, they have best case examples of dealing with a lot of these, in a lot of these instances, what people believe are intractable problems. So it recommends reducing income inequality by ensuring equal pay for equal work through policies that include paid family leave, paid sick leave, universal basic income, living wage laws, child tax credit expansion, and the earned income tax credit. Dr. Holmes, who's a clinical associate professor of family medicine in the UB Jacobs School, said that medical school is taking more steps to address racial and cultural biases that seep into healthcare, just like they do in other parts of American society. He recommends a holistic approach to better regional wellness with a greater emphasis on improving mental health. I found that about half the patients at the ECMC Family Health Clinic are there because of unhealthy ways of coping with stress. So patients have long used food, and let's say people have long used food, alcohol, and other drugs for comfort, choices that intensified during the pandemic, Dr. Holmes said. He advocates a healthcare model based on the physical, emotional, social, and spiritual well-being of patients. Disease prevention should be stressed, and related education taught by trusted advisors that include church, cultural, and neighborhood leaders. Regional counties during the last half decade have adopted Live Well initiatives to address county health rankings and similar reports. And Erie County, a couple of years ago, created an Office of Health Equity. Those changes and filling gaps don't happen overnight, Burstein said. In fact, some of our initiatives and services might not show improvement for years or decades. Still, it is vital work. Now, here are some perspectives about what we can do now and what you may be able to do now. So some historical context on average life expectancy. I've argued these with my chiropractor, who's an anti-vaxxer and thinks the vaccine didn't really help matters much during the pandemic. And I always bring up these numbers. For all of the challenges we have as human beings in the 21st century, our life expectancy around the world is considerably higher than it was. That's something to keep in mind. Wellness is the conscious development of the whole self. Embarking on a wellness journey is a process of searching for the appropriate tools to help make you a healthier and happier human being, plus discovering your own effective methods and using these tools for continued growth and development. The system here in Western New York is changing too. Whoops, sorry about that. Telehealth is widely available after the pandemic. Chiropractic care is covered, and I still see my chiropractor, even though we have a difference of opinion on the vaccine. Most health insurers provide money and other rewards for health screenings. The UB Medical School in 2019 offered its first class on nutrition to medical students. So people who complain about that need to know. The campus is also looking at healthcare inequities in the region and offering healthy foods on the medical campus. There's a concerted effort for that. Fitness strengthens the region and opportunities are plentiful here. Outdoor classes year round. My refresh cover story last week was on outdoor fitness possibilities, including the November project, fitness in the parks and fitness at Canal Side and the Outer Harbor. There's been an explosion in yoga in the region in recent years for a good reason. That's a holistic form of exercise. And then Refresh has all of these sorts of things in its pages weekly. So getting real about well-being and healthcare, it's more important to add life to your years than years to your life. It's something that Bruce Trone, Dr. Bruce Trone with the Society for Success, or the Center for Successful Aging at UB, tells me when I interview him. Every time he tells me that. Medications can help. Blood pressure, diabetes, and a host of other medications can extend life and well-being. But pills don't always work, particularly for those who are unwilling to eat healthy, exercise regularly, and address stress. Again, self-medication is not always the way to go if it involves alcohol and drugs. Moderation and balance and resilience matter when it comes to well-being. And the winning combination, like Dr. Holmes said, is a holistic one. So what all of us can do for better health. Global Wellness Day happens to be this Saturday. And there's a web address there if you want to take a look at it. And this year, they are interested in advocating 3 simple steps when stress and anxiety become hard to bear. Stop what you're doing and calm down. Take a deep breath and exhale. Afterwards, smile. Smile in spite of everything. And in Western New York, that can be hard this year, these days, but something that still we need to try to do when we can. Walk for an hour. Think about all the ways that walking can help physically, mentally, and spiritually, especially if there's a nice place to walk near your house. Drink more water. That's something that a lot of us don't always understand when it comes to our overall health and well-being. And eat healthier food. To consume foods which are produced through natural methods by using appropriate fertilization and weed control techniques without using pesticides and certain chemicals. And of course, read reliable journalism. Obviously you would expect somebody like me to recommend that. But it's up to you to do what you can. And there are a lot of efforts that are taking place in the region to try to be helpful and supportive. But there needs to be some personal responsibility as we roll. And this is my last slide with some helpful websites on it. I've also forwarded to the library organizers for this presentation a PDF version of the May 14th Refresh story about the county health rankings. And I hope they'll throw that up on their Facebook page and YouTube page as they go. Back to you, Dennis.
Scott, that was a wonderful summary of a lot of data. We like to call ourselves data-driven in our country and world. Excuse the voice coming off of a cold. And as such, would like to thank you, Scott, for a great summary. Here would be my lead question. Many of us were aware before the terrible events of May 14th that zip codes matter. We talk about wellness. We've talked about wellness for years. We almost do it with a smile as we promote chicken wings or something of that sort. But I had hoped that the pandemic would actually have helped us move about more, go out for walks, the waterfront, wherever, neighborhoods. It's not showing up in the data that there's an effect, and you almost get to a point where you say there's got to be a culture change. My question is, the communities that rank ahead of us, the communities that move up the rankings, is there a way in which best practices are shared in the state, in the country, especially through the Robert Wood Johnson's Foundation, so that we can say, wait a minute, look what they're doing in Baltimore, look what they're doing in Cleveland, look at what they're doing elsewhere to deal with changing a culture and trying to be improve wellness and measure that. Your thoughts?
Well, here's what I would say after looking at the rankings for probably a good 5 or 6 years, and that is that wealthier communities that have more access to quality health care and other programs tend to rank higher. The highest ranked counties in New York State for health outcomes and factors tend to be in and around the New York City area, mostly suburban New York City. A couple of the boroughs don't do all that well and have some of the same challenges we have. So income, availability to education, becomes important. But here's what I'll say the rankings also show in Erie County in particular, in Western New York, that we have, I hate using this word in stories, but that we have the infrastructure here for well-being. Our health facilities, medical wise, our access to doctors and primary health care is generally pretty strong compared to even some of our neighboring rural counties. That availability of fitness, exercise stuff, I've seen grown for health rankings. This is, as I said, this is the first year I remember it being higher in Erie County than statewide, which is really promising. So right now in Erie County, I feel that we're in a place where we have that infrastructure in place. And now it's a matter to do the heavy lifting that involves listening to people of all races, economic backgrounds, health challenges, and figuring out ways to make that infrastructure more available to them in their communities. So that's going to be the trick. You're not going to be, there wasn't much to learn about best practices during the pandemic. I mean, it was, all of us were just trying to do the best we could. But I expect that I'll be writing, and some of the other news reporters will be writing stories in coming months and years about best practices elsewhere. It's called solutions journalism, and how maybe we can bring some of those into improving well-being in Erie County.
Scott, that's good to hear. Leah, questions from the audience?
We do have a few questions. The first is, and you might have answered this a little bit already, but are there any methods for improving public health that the healthier counties of New York State are doing that we should be doing in Erie County?
I think I hear a lot about education being really important as far as this is concerned. So I think we just keep doing what we can do. Phil Habistro, who passed away a couple of years ago and was key to the wellness community here. He ran the Wellness Institute of Greater Buffalo, always pointed to cigarettes. And I've had others in recent weeks after the shooting point to seatbelts when it comes to gun violence. And, in both of those cases that you try to make incremental changes, you experiment a little bit and with some of the ideas and see how they work at the local level. And if they don't work, you try something else. So I think, other folks, like I said, they've had some advantages to some of the challenges that we talk here about health inequities, but we have that infrastructure here. A lot of people are working on these challenges in Erie County now. And I think, and I hope and pray that we're going to make a significant impact here over the next half a decade or so.
Our next question is, As you pointed out, race-based and income-based inequalities account for why Erie County is 46 out of 62 counties. It's kind of a difficult question maybe, but can you comment from your perspective on how we as a community can begin to make the systemic changes that are needed to reduce the inequalities?
You know, there are a couple of other folks on the call who might be better at answering this question than I. And I believe Dr. Tim Murphy with UB, who's been very involved in health equities here, is on the call. But what I will say is we all, and this has been the conversation right now in the last few weeks. You know, we have to focus on, in my estimation, but you know, dealing with lead paint and housing in poor communities here. That could make a great deal of difference when it comes to raising the health. We need to make sure that people have safe, walkable communities and healthy, affordable food in every corner of Western New York, not only in the city, but also in some rural areas where that can be a problem. Transportation. These are, I mean, there are a lot of things on the drawing board for these things, but they, you know, those social determinants of health are going to be the things that that really drive improvements that we make here.
This is,
Oh,
go
sorry.
ahead. Go ahead.
Go ahead, Dennis.
I was going to say this is an important topic, so we'll run over a few minutes. The library will give us blessings to do that, I trust. But for the archival purpose, I think this discussion is most important. Any other questions, Leah?
Yes, there's one more question. If we have the infrastructure in place for a well and healthy population, where are the loopholes? Why aren't we more healthy? And what will it take?
You know, I think we've kind of gone through some of that. I think we have to help people who are determined to live healthier lives. We have to educate folks who may not understand that the daily choices they make have an impact. And I mean, that starts sometimes in a hospital and in a primary care office. But how much time do we all spend in a hospital or primary care office? I mean, this as I said in the rankings point out, it's the, you know, culturally, the neighborhood you live in. Are you hearing positive affirmations in church, community centers, in the neighborhoods? Are the stores doing some of the right things to promote healthy eating? Are there enough exercise facilities? You know, or access to exercise that's important. I think all of that goes. But I mean, if it was easy, everybody would be able to do it. And we do have free will as individuals, and we certainly have heard a lot about freedom over the last 2.5 years during the pandemic. So, you know, one of the bottom lines is we do as a society live a lot longer generally, but boy, we've got our hands full with a number of problems in dealing with that nut, right? Where does personal responsibility meet free will, right? And rights. And that's, I mean, that's a national discussion that we should be having now, and a regional one, until things start to improve a lot more than you know, than the conditions we have right now.
Scott, let me offer this observation. Today's Buffalo News. See it there, but I'll just read the front page headline: Top shooting spotlights urgency of state support for East Side projects. I'm just wondering, when we do projects and money funnels in, do we use the metric of well-being, wellness as an outcome to have some sense of why we're investing in the community? Is that something to be considered perhaps as we look at a wave of investment that seems heading our way? How do we incorporate our wellness as a community into the outcome we hope to have for the investment we're making? Is that a thought process to consider?
Yeah, and I think Mark Summers' story today was really an exciting one. But it was also tempered with some caution. I mean, we're having, I forget the number, I think something like $283 million that's coming into the east side for job development and redevelopment projects and housing and all sorts of things that should be part of the larger recipe in helping to renovate the east side of the city. And one of the things that excites me about some of the greater efforts that have been made in recent years, I've been a reporter for 35, 36 years. I've covered, covered farm workers in South Florida, and I've covered all different communities, some challenged more than others. But only over the last 3 or 4 years in Buffalo have I heard the talking heads, right? The people who are in the White Towers say that it's time to start listening to people in the communities that they're trying to help, involve them and include them in the decision-making process, and work from the bottom up instead of the top down. That was a process that helped on the Buffalo waterfront. Maybe if we flip the script here a little bit, when it comes to investment and health and well-being, marrying the two of them, we can lift the whole community here.
Good observation. I think we best start to wrap this up. Any last minute questions, Leah? Hello, Leah.
There was, someone just made a comment that ARP has classes at some point on eating well.
Yep.
AARP.
AARP classes. There are all sorts of efforts, and I know not everyone can afford necessarily the news these days, but Refresh tries to keep up with a lot of those things online and in social media. I know right now you can get an online, an online subscription to the news generally for about $1 a week. So, the information that you're going to find there on healthy eating and exercise and just the way the community is working and the opportunities available, a digital subscription might be helpful for stuff like that.
Well, our goal is to continue this discussion. The Imagine program, although it'll be shutting down in the summertime, resumes in September. And if there's anybody in the audience, you mentioned some of the folks that you observed their name, want to be speakers on this subject, please let us know. You can send me an email at imagine.buffalo@gmail.com, and I'll be glad to, put you in the potential speakers category. How's that? So, and so we can continue this from different angles, this discussion. We certainly found with COVID that zip codes matter. Suddenly we had higher death rates. We find that poverty matters by zip code again. And now we're finding and reinforcing the idea that zip codes in counties matter in terms of the county's ranking. So we're only as good as our weakest links, if you will, and we've got to see how we can improve ourselves. That should be everybody's goal. It should be all of our investment goal, is to how do we improve our well-being, our wellness. Imagine Greater Buffalo as a healthy, wealthy, and sustainable community. I think the three go hand in hand. All right, that will wrap it up. Thanks again to our speaker, Scott Scanlon, editor of the Refresh magazine at the Buffalo News. Next week, we have 2 more weeks to go before we do break for summer. Bob Shibley, Dean of the UB School of Architecture and Planning. He'll be speaking of Olmsted's design and Buffalo's future. That's part of, we've been reviewing our Buffalo Day at Chautauqua speakers. Bob will be part of one of 3 people on a panel hosted by the sustainability director at Chautauqua, Mark Wensler. And that will be July 5th. If you haven't heard, everyone from Buffalo zip codes 14201 all the way through 14280 will be free for the entire day at Chautauqua on Buffalo Day, Tuesday, July 5th, coming up here in less than a month. So mention that to others. Hope you support the project. Hopefully we'll keep growing Buffalo Day. This is the first year where the whole day is free. Previous to this, the previous 12 years, just the afternoon was free. So we're making progress. Thank you, folks, for supporting this program by being in attendance. I'm Dennis Galucki. Be well and good day.